Good day, I am Dr. Liza Theunissen from South Africa, and in today's video we will be discussing the microvascular complications that could occur when you have uncontrolled diabetes. Uncontrolled diabetes is where you have high blood sugar levels for long periods of time. When we eat something that contains carbohydrates like bread or an apple, or drink something like Coke or juice, our bodies digest it and converts it into glucose, also known as blood sugar. The body then uses a hormone called insulin to unlock your cells so that the glucose can enter the cells and the cells can turn it into energy. When there is a shortage or dysfunction of insulin, this will cause the blood sugar levels to rise. Think of glucose as little shards of glass that can cut you. When there's too much glucose in the blood, the glucose or shards of glass can start doing damage to the small blood vessels in our bodies, and this will then lead to vascular complications. So, why do you get complications from diabetes in the first place? And what are the two main vascular types of complications? We have two categories of vascular complications: macrovascular, where high sugar levels causes damage to the large blood vessels or arteries in our bodies, and microvascular, where high sugar levels cause damage to the small blood vessels in our bodies. The macrovascular complications include coronary artery disease, for instance heart attacks, cerebrovascular disease like strokes, and peripheral vascular disease. Today, however, the main focus will be discussing the three microvascular complications of diabetes: neuropathy, retinopathy, and nephropathy. So, let's delve right into it. Let's look at diabetic retinopathy first. There are small blood vessels that supply the retina with glucose. The retina is the light-sensitive tissue lining the back of the eye. Unfortunately, high blood glucose can cause damage to the small blood vessels in this area. It can be difficult to diagnose diabetic retinopathy because sometimes in the early stages you will not even have any symptoms. But if you have diabetes, it is important to visit your doctor to go check it out. What would be the symptoms to look out for? We can divide diabetic retinopathy into two stages depending on the progression of the disease. Non-proliferative diabetic retinopathy is the first stage, and this simply means that the small blood vessels around the retina start to bulge and leak, making the retina, or more specifically the macula, swell. This is then referred to as macular edema. Some of the blood flow to the retina can also be cut off, which means that the macula doesn't get the necessary oxygen or glucose it requires. When this happens, your vision will be very blurry. We also talk about seeing cotton wool spots. The next stage is proliferative diabetic retinopathy, and this is where the situation is getting worse. In this stage, we see new abnormal vessels form to replace the damaged ones, but the new ones are so weak and fragile that they can also start to leak blood. If they leak only a little blood, it will look like you see dark spots or floaters in your eye, and if they bleed a lot, it can block your vision. It can even happen that your retina detaches from your eye, which is the most severe form of retinopathy, and this will ultimately cause blindness unless you are able to treat it quickly enough. How can I prevent diabetic retinopathy? The best way to prevent diabetic retinopathy would be to make sure you control your blood glucose, blood pressure, and your cholesterol levels effectively. Take your medicine as prescribed by your medical doctor. Eat healthy, get some exercise, stop smoking, and limit your alcohol intake. You should also visit an optometrist or eye specialist for an eye examination as soon as you can after being diagnosed with diabetes, and thereafter every year. If you are experiencing any problems with your eyes, your eye specialist will be able to help you treat it. Now, let's look at diabetic nephropathy. Diabetic nephropathy, also called diabetic kidney disease, develops when high blood glucose levels have caused damage to the kidneys and the function of the kidneys start to decline. Our kidneys get rid of lots of waste material via our urine, but when they are damaged, the waste starts to build up in our blood and it makes us sick. Your kidneys have multiple functions in the body, for instance, helping to control your blood pressure and also helping to produce red blood cells, but to name a few. Some of the symptoms of diabetic kidney disease include fluid buildup in the feet, poor appetite, shortness of breath, itching of your skin, having a weird metallic taste in your mouth, and some people's urine even look like frothy beer. There are 6 stages of diabetic kidney disease, where with each stage the kidney function declines to the point where someone would need dialysis. This is then called end-stage renal disease. Your general practitioner should test your kidney function each year. It is a simple blood test where we test for serum creatinine, urea, electrolytes, together with a test called the GFR. If a blood test shows that our creatinine or urea levels are high, it means that your kidneys are struggling to excrete the metabolic waste from your blood. There are also urine tests that can be done to detect early diabetic kidney problems. How do we manage or prevent diabetic nephropathy? Apart from managing your blood glucose, maintaining a healthy weight and stopping smoking, it is very important to manage your blood pressure and cholesterol levels as well. There are a couple of drugs that your doctor can prescribe you, but your diet plays the biggest role in this condition. It would be wise to visit a registered dietitian to help you with your nutritional goals, because you can improve your kidney function by eating less of the food that contains the ingredients your kidneys are struggling to filter out. Lastly, we will be discussing diabetic neuropathy. There are 2 main types of diabetic neuropathies, namely peripheral neuropathy and autonomic neuropathy. Here we see that high blood glucose levels damage the nerves in the nervous system, making it difficult for them to send the appropriate signals in the body. You can experience neuropathy mainly in your feet and hands. Some of the symptoms include severe pain, numbness, and tingling in the affected areas. Some people may also experience what is called the diabetic foot, where they develop ulcers and infections that take long to heal. Neuropathy could also contribute to complications of the heart, stomach, sexual organs, and the urinary system. When it comes to your feet, it would be ideal for you to visit a podiatrist once a year. A podiatrist looks at any ulcers and complications you might experience in your feet, and they help you manage it effectively. Some practical tips to take better care of your feet include never wearing sandals or flip-flops that exposes your feet and toes. Never put your bare feet near a fire or a heater. Always wash your feet and dry properly between your toes, and regularly ask someone to check whether you have any cuts or sores on the soles of your feet. These tips will help prevent you from accidentally burning your feet or cutting your feet with sharp objects on the ground, or developing athlete's foot, which could cause serious infections. I hope this video has shown you that you can prevent these microvascular complications from occurring by taking care of your health and controlling your blood glucose levels more effectively. And if you do experience these complications, you have a healthcare team that is willing and able to help you manage it. Diabetes really doesn't have to be a death sentence.